Hey everybody, welcome to Health Matters with me, Ryan O'Connor, in association with CIPLA. Now, while HIV and AIDS is not the pandemic that everyone has been speaking about mostly over the past couple of years, it's still a global challenge that affects all of us. Dr. Precious Garnett is here, marketing manager and medical advisor to the infectious disease and vaccines portfolio at CIPLA MedPro. Passionate about infectious diseases, adolescent health, and global public health. And she joins us this week in Health Matters. Doctor, thank you.
Good morning. Good morning. How are you?
I'm good, thanks. All things considered. Now, I want to ask you first off, what does World AIDS Day mean to you? I know it's happening soon.
Yeah. It actually just happened.
Correct.
The 1st of December.
Absolutely.
It is a very special day. Obviously, being involved in HIV and AIDS work.
Yes.
But one of the most significant things that was said in this year's commemoration was World AIDS Day should be every day. Right.
Yeah, absolutely.
But it is a day where we remember where we come from in this pandemic. We remember the people that we've lost. We remember the people that have been affected and infected by this disease. Yeah. But mostly just an appreciation of how far we've come.
Yeah.
Because we've come a very, very long way, right?
We have. And we've been sidetracked, as it were, over the past 2 years by the pandemic. And there always seems to be something else that comes along to grab the limelight, as it were, and the focus. And then when that happens, it also then means that sometimes, to a degree, the resources too. So these are things that we kind of keep top of mind when we talk about HIV and AIDS, and the need to keep it relevant as always, and the conversations going. Why did you choose to be an HIV specialist? Where did your passion for this particular issue come from?
That might take us an hour. So, but in summary, I grew up in rural KwaZulu-Natal. And I remember, I'm not that old, but in the late 90s, early 2000s, I lost a lot of family members to HIV. And back then, there was no name to this disease. Just left, right, and center. And it wasn't okay. Like, it really wasn't okay. I was a small child then, but it wasn't okay. I wanted to do something about that. So my grandmother will tell you that I've been a doctor since I was 4.
Oh, man.
And this is why, as you were speaking about World AIDS Day, remembering all of that so that we can continue soldier on and still continuously putting the gas in the pedal is important.
What is the state of HIV in South Africa at the moment? What are our wins? Maybe we can reflect some of the challenges too.
So we've come a very long way. We've come from when there was no medicines at all and people were dying left, right, and center to, you'd remember, I don't know if you'd remember, I hope everybody does remember because this was a significant part of our fight against HIV. When Treatment Action Campaign took the government and the president to court so that so that people can have access to ARVs. We come from there to now where you have 3, 4, 5, 6 different options of medicines.
Absolutely.
So it's been quite amazing. A lot of work. Different stakeholders have been involved in this, and we had by 2020 we had our goals, right? Not only South Africa but
globally.
Global health. 90% of people that have HIV should be diagnosed. 90% of people that are diagnosed should be on treatments, and 90% of people that are on treatment the virus should be controlled.
Yes.
We reached 2 out of 3, which is a pass mark, I think.
Yeah.
At least
it was.
When I went to school, it was a pass mark.
Exactly.
So we did achieve the first 90 and the third 90.
Yes.
We're still working on the second 90. In our pass mark, after 2020, we pushed the envelope to 95 by 2030.
Wow, that is staggering.
And so this year's commemoration was in the Free State. There's districts in the Free States that have reached the 95s.
Jeez,
how amazing is that?
It's incredible. And it's amazing because you look at the kind of work that's being done and you talk about the rural parts of South Africa, about how, technology and medicine has evolved to the degree where, if you're on and you stick to your medical regime and you take whatever's prescribed to you, you'll be okay. How do you find, and this is a question that it's not down on the paper in front of me, but how do you find, the education in terms of telling people Take your medicine every day, because people want to know why they're not getting better or why they're getting worse and showing other symptoms. And you find out that simple things, and it's not only HIV, it's any chronic medicines. You find that the biggest fault is the defaulter, the person not taking their medicine on a regular basis.
Taking medicines every day for life is difficult, no matter what disease you have.
Yeah.
It is difficult. And it becomes even more confounded when there's a lot of stigma around the disease, when you have to hide your medicines, where you don't necessarily have social support. It becomes very, very difficult. And a lot of patients, especially in the HIV space, they speak about pill fatigue. Because not only are you forced, because you are forced, whether it is you are forcing yourself or to take these medicines every day, but every time you pick up that bottle, it's a reminder that I live with this disease.
Absolutely.
With this dreaded disease. So as much as we have solutions, there are still a lot of challenges that come with it.
Absolutely.
And we especially see with PrEP, which is prevention of HIV tablets. And it's 1 tablet once a day, and young people are struggling. And they even go as far as saying, how do I take a pill to prevent taking a pill? and it's a very good question.
Exactly.
Because if you have HIV, you have to take a pill every day for the rest of your life.
Absolutely.
But we're saying to young people, to prevent taking a pill every day, you have to take a pill every day.
Man. Doctor, the United Nations program on HIV and AIDS has set a goal, that we know. Realistically, you mentioned that 95. You're on track. I think there's a good chance it'll happen before the prescribed date of 2030.
Actually, the Minister of Health was speaking about accelerating this for South Africa to achieve 95 by 2025.
Just last 5 years off the target.
Yeah, very, very ambitious. But ambition is good, because then it puts a lot of pressure for the resources to be put in, for the necessary interventions to happen. Are we going to get it done? I remain optimistic, cautiously optimistic.
I love that. And I mean, we're living in an age where anything can happen. This podcast, this video, in 10, 20 years' time, you and I will be avatars. This will be watched again, and you and I will be replaced by avatar versions of one another. That is how technology
I hope my avatar
evolves.
will be cute, though.
It will be, very. How do you anticipate an end, or do you anticipate an end rather to the pandemic?
It's a very good question, because we speak about the end to HIV. I don't, in my lifetime at least, and I'm not that old, in my lifetime, I don't anticipate a world that exists without HIV. I do think that the success that we are going to have is, one, people not dying from HIV anymore, and two, maybe not getting new infections.
Gotcha.
Because we still have 36 million people in the world living with HIV. We have medicines for it. They will live. Their lifespan has normalized. They will live until they're 70, 80. And right now they're probably in their 40s. So by 2030, no, there'll still be a lot of people living with HIV, but the infection should be controlled, and we should not be getting new infections. And we should have better medicines.
Absolutely.
We are about to get injections.
That is incredible.
Yes.
So that's the next phase.
Yes. And even longer acting ARV. So instead of taking a tablet every day, you can take an injection every 2 months. Or
brilliant.
Also in the works is implants.
Oh.
You can have an implant.
See, the technology that's on the doorstep and being implemented currently, I think that's the way to go. I have to take chronic medication every day, twice a day, for epilepsy.
How's that for you?
And that is terrible, because I'll tell you why. The questions you get when you're traveling with people and you open up a medicine container and you take pills, the first thing that goes, what are you taking? Why are you taking it for? What's the story? So I can understand anyone living with a chronic condition, living with HIV, the questions that they get asked by family members, by friends, because after all, these people aren't just taking the medication at home. They're taking it at their place of work. They're taking it socially when the time is, and it's sticking to that regular time frame as well. of making sure if I take my medicine, I've got to take it at the same times every day. Because when you're on chronic medication, it doesn't matter what it's for. You feel when you haven't taken the medication. I mean, you can feel it. You feel something's not right in your world, and it's you're missing that dose of whatever it is that you're on. So I can understand the stigma attached to it, why people want to avoid in public spaces, not wanting to do it. But then I realized with epilepsy, like HIV, and although they're worlds apart, they both require a lot of education. And not only education around others that have it, but around diagnosing and getting yourself tested to make sure you know your status, to know what it is that you have. Many of these symptoms don't show up for a long time.
Long time.
But again, if it boils down to the education, and I think it should be top of mind, not only on World AIDS Day, but every single day in South Africa and the world.
Exactly. And one of my calls to action, if we are to achieve this 95 by 2030, is that from policymakers to doctors to different stakeholders that are involved in trying to achieve these goals, we need to also take a step back, because we've had HIV for the last 40 years, 4 decades later, right? We need to take a step back and look at, so why have we not achieved? Because we did it, we covered.
Yeah, absolutely.
What,
2 years, exactly.
Done. And 4 decades later, we're still battling with HIV. Like, we need to take a lot of learnings. Yeah. We need to do a lot of reflection.
Yes.
And we need to maybe change the course of our strategies. Amazing. Like, look at education, for example, young people.
Yeah.
Brochures don't work for 15-year-olds
No one
anymore.
wants to read a brochure.
Right? We need to think about how to educate young people around HIV, preventing HIV, in the medium, in the language that they understand.
Absolutely. Listen, this has been such a great chat. Thanks for joining us and enlightening us on what the current state of the country and the world's update is on HIV, and that the fight is an ongoing fight in terms of all of the things we've mentioned, whether it's education, whether it's making sure people take the medication on time, whether they get the right medication for what they're going through, whether it's HIV or epilepsy. And thank you, for your time today. It's been amazing.
Thank you for having me.
And you're right, you're a spring chicken still. If you're watching this video, you can see for yourself, she should be on the cover of a Cosmopolitan magazine. Dr. Precious Garnett, thank you so much for joining us on this edition of Health Matters. If you like it, please subscribe. Give us the thumbs up, and we'll catch you again for another one soon.